Hi, my name is Hyungdong Kim. I'm a hepatologist at Asan Medical Center, Seoul, Korea. It's a great honor for me to present our study entitled Evaluation of Early Hepatocellular Carcinoma with Galactic Acid-Enhanced MRI Detects Additional Lesions and Increases Overall Survival. Our interest in this subject started from clinical experiences of HCC cases that had additionally detected HCC nodules by galactic acid-enhanced MRI. Current guidelines on HCC recommend 4-phase dynamic CT or MRI with extracellular contrast agent for staging and diagnosis of HCC. However, these imaging techniques have limited sensitivity, especially when the nodule is small. This may contribute to high recurrence rate of HCC even after curative intent treatment, because at least a third of early HCC recurrence may represent pre-existing dissemination of primary tumor that was not detected at the time of treatment. Thus, accurate assessment of tumor extent is critical for reducing recurrence as well as for defining HCC stage and treatment strategy. Galactic acid is a new contrast agent for MRI that has combined perfusion and hepatocyte-specific properties. Hepatobiliary phase images of galactic acid-enhanced MRI improves lesion detection by increasing liver-to-lesion conspicuity. We first evaluated whether adding galactic acid-enhanced MRI to the staging workup of HCC led to improved clinical outcomes such as patient survival. In this historical cohort study, 700 patients who were assessed to have single nodular HCC by 4-phase dynamic CT were included as study population. Of these patients, 323 were additionally staged with galactic acid-enhanced MRI before treatment. This group was defined as CT plus MR group. 377 took only 4-phase CT and referred to CT group. After additional staging with galactic acid-enhanced MRI in the CT plus MR group, about 16% of patients had additional HCC nodules, increasing the BCLC stages for 13% of patients. By Kaplan-Meier analysis, the CT plus MR group showed significantly higher overall survival than the CT group. Among patients who received curative intent treatments, the CT plus MR group showed significantly better recurrence-free survival. Let me show you a representative case. This 58-year-old male with HBV-associated cirrhosis was assessed to have a single nodular HCC in segment 6, and no other suspicious nodule was identified by 4-phase CT scan. However, 2 additional probable HCC nodules were found in segments 6 and 7 at the portal and hepatobiliary phases by galactic acid-enhanced MRI. So, the initial plan of surgical resection was changed to liver transplantation, and the explant liver pathology confirmed that all the 3 nodules detected by galactic acid-enhanced MRI were true HCCs. In conclusion, among patients who underwent dynamic CT analysis of single nodular HCC, additional evaluation with galactic acid-enhanced MRI led to detection of additional HCC nodules in 16% of patients and reduced HCC recurrence and decreased overall patient mortality. Thank you very much for listening.